President Trump making it official there, signing his name to an official order declaring the opioid crisis to be a national public health emergency. The president joined there by families of people who have lost family members to the drug crisis. He spoke of this as a national shame and a human tragedy, invoking his brother Fred Trump, who died prematurely because of complications from alcoholism. He connected the opioid crisis up to his favorite themes of immigration and the border, saying that he will raise this issue with China next week on his Asian trip, and also saying that this is part and parcel of his effort to tighten the borders here at home. He talked about new regulations, and he talked also about the need to help people who are hooked and the need to help prevent people from getting hooked. Joining us to make sense of all of this are several ABC News contributors, among them ABC's Mary Alice Parks. She works for the political unit. Also on the phone is Dr. Jen Ashton, the chief medical correspondent. Mary Alice, first to you. This has been something that President Trump has been talking about on the campaign trail for quite some time, hasn't he?
Absolutely. You know, I traveled a lot on the campaign trail as well, and I was struck by the fact that this issue came up every single place we went, from Boston to Seattle, but especially in rural parts of the country, West Virginia, rural, remote New Hampshire. It's part of the reason you saw so many governors there in the room with the president. This is an issue that came up nonstop on the campaign trail, and that I think you saw the president really took to heart. He was incredibly empathetic, I thought, in that speech, like you said, talking about his own family, and made a point of making sure that people understood how serious he was taking this.
Great. Stand by with us for a moment, Mary Alice, but I want to go to ABC's senior White House correspondent, Cecilia Vega, who joins us by telephone. Cecilia, he declared this to be a national public health emergency. What does that mean?
Well, you know, there's a little bit of controversy over this, perhaps not surprising, David. The president had for months been saying that he would declare this a national health emergency. And in fact, that is partly what his own commission on opioids recommended. So he's falling short of going all the way there. But his commission also gave him the option of declaring this a public health emergency. So big picture what this does. Let's just talk about a couple of things. It frees up some of the bureaucracy in terms of grant money to clinics and things like that. It helps overcome a number of bureaucratic delays and things like hiring specialists to treat addiction. In very specific ways, this is going to expand access to treatment for patients in rural areas, for example. These patients will be allowed to use telemedicine, the internet or the phone, to reach a doctor to help them with prescriptions for addiction. But what it doesn't do, this doesn't increase funding. The White House aides are telling us that they hope Congress picks that up down the road. You know, in the big picture, it's unclear really what this will do on the ground, what it will actually achieve. Experts, many of them say that this is largely symbolic, but nonetheless, this is being widely applauded as a big move, be it symbolic by this White House, because it creates a sense of urgency for a problem that you and I both know, we've covered this issue, is very much a national crisis. We're talking about 142 deaths a day in this country, and opioids are to blame for that.
As the president said, there are more deaths from opioids in this country than from motor vehicles and gun violence combined. And yet, as you point out, there's some question here about the commitment of money. The Public Health Emergency Fund, I read, now stands at $57,000. The current budget for the Health and Human Services Department would cut funding to that department. So there's some question here, isn't there, about the commitment of money?
Exactly those points, indeed, and not just that. Let's not forget that there is no drug czar in this administration right now. There is no director of the Health and Human Services Department, and as you were saying, this comes as this administration has pushed for unprecedented cuts in federal aid to states for Medicaid programs, and Medicaid has proven to be one of the most effective tools in combating opioid addiction. So those are the big questions that are out there right now. But I do have to go back to what we have heard universally from doctors and from addiction specialists who say it is unclear how much this this will actually do in terms of tangible effects. But really, even if this is symbolic, people are very in this industry and in this community very, very happy to see this prioritization of opioids and the crisis in this country as a top priority from Washington right now.
ABC's Cecilia Vega, thank you so much for joining us. I know you've got to get on to World News, and we look forward to your report tonight. Let's move along now to Dr. Jen Ashton, who is joining us by telephone. She's ABC's chief medical correspondent. Hi, Jen.
Hi, David.
So, what is your sense of what's needed here?
Well, let me take you behind the scenes because I want to pick up on a couple of points that Cecilia made about, what's going on the federal level and then what's going on in the trenches, so to speak. So I want to share with our viewers and our listeners, I'm a practicing physician. I maintain a private practice. And every year, every healthcare provider with a prescription pad that has a DEA number and a controlled dangerous substance, it's called a CDS license number, has to renew those licenses. Of course, we have to pay for that, but in many cases we have to take some new CMEs, continuing medical education, answer some questions, et cetera. I just completed mine literally yesterday for my license renewal, which is due the end of this month, and I had to answer questions about opioids, and we have to register in the state of New Jersey as a physician who can prescribe this class of medication, and it tells you how pervasive this approach and this attack is. This is absolutely affecting change at the healthcare provider prescriber level, which I think is a good thing because let's face it, a lot of healthcare professionals who prescribe these medications aren't doing it because they want someone to become an addict. They're doing it because 20 years ago in medical school or 30 years ago in medical school, that was the only class of pain medication that those providers knew about. So re-education needs to occur. Pharmaceutical development, I was happy to hear the president mention that. That absolutely needs to occur. But I also want to address something that's often a forgotten voice in this debate and in this crisis, which is the millions and millions of Americans who live and suffer from chronic pain, and they are so fearful that there will be an overcompensation, a backlash, to an over extreme that will affect them getting some kind of pain relief, whether it is from the proper use of opioids, in some cases, or with other things. And I think that is a very real fear. And we need to remember in the medical profession that the goal is treating pain. The goal is not to withhold pain relief from a patient. But I will tell you, as someone that I'm proud to say I got the pharmacology award in my graduating medical school class at Columbia, we need a much better class of medication than opioids for pain. It has never been ideal. And now, of course, we know that not only is it not ideal for pain in many cases, but it does lead to addiction and death. So I was very, very happy, even if this was a formality, to hear this coming from the top down as well as the bottom up.
As you point out there, that some of the new regulations he proposed there are making some supplies of pills 7-day only supplies. That could be tricky for somebody that's right. Being prescribed pain medication. He also talked about taking at least one specific drug off the market. Is this something that he's going to get much pushback from the pharmaceutical industry or from the drugstores?
I don't think from the drugstores. I think the pharmacists are already way on board with this because they've already been incredibly helpful with trying to limit the amount of these medications that a patient can go home with. And I want to tell you, as someone who performs surgery, as someone who's had surgery as a patient, oftentimes, this is a real problem. Patients having surgery are given 45, 50, 60 pills. In the short-term postoperative period, we have better medications to treat that kind of pain than opioids. So I think that the removal of fentanyl off the market, it should only be used in a hospital setting when it is safe and effective and appropriate. outpatient setting, I agree with that as a medical professional. And I think that we definitely need better options for patients who are dealing with acute or chronic pain. The opioids are not the answer.
Thanks so much, Jen. Let's bring in Geneva Sands. She works with the Justice team. Geneva, you have been covering some of the front lines of the opioid crisis with Pierre Thomas. Tell us about the Nightline stories you did last summer.
That's right, and this epidemic is something that reaches all corners of the United States across the nation. So we partnered with Nightline and our ABC affiliates to try and quantify the scope of the crisis that was hitting across the United States. And one thing we found is that it's really hard to track in real time the data of overdose deaths, of overdoses. State health departments and hospital associations bring in that information in all different kinds of ways. And that's one thing that health experts say could really make a difference is real-time data tracking. And so we looked at across the US, and like the First Lady was saying, the thing that really stood out even more than the shocking numbers, and their numbers are incredibly high, was the individual stories that we found during that week this summer. There was a woman in her early 20s. She had just gotten out of rehab in Kentucky. Her family thought she was on the right track, and she stayed over at a friend's house, ended up in the hospital. Her mother got a phone call saying, "You need to get here immediately," but it was too late. She had died of an overdose, of a heroin overdose. And her family spoke out that week to us and to others to try and prevent the next case from happening. There was a little girl in New Hampshire, a really young girl, who was clutching the photo of her father that had also died of a heroin overdose. She was left without a father. And in Miami, a 10-year-old boy accidentally came in contact with heroin, and it's those stories that really touch you.
As you say, the First Lady said this could happen to any of us. She said no state has been spared, no demographic untouched by this. And Mary Alice Parks, going back to you briefly here, I wonder, this is something that is near and dear to the hearts of Trump voters. And there's a sense out there that in places where there's been a middle class or a working class that's been left behind, factory closures, jobs shipped overseas, that people have in some of these communities turned to drugs, and often with tragic results.
Yeah, I thought it was really amazing how the president was able, in one speech, in a way that I don't think we've seen him do before, talk about such a wide range of solutions, from international commerce to very intimate conversations that people could have with their friends and family. Really encouraging community leaders to step up to the plate here, like you said, in maybe some of the hardest hit areas, some rural parts of the country. He was really imploring people to take a personal stake in this as well, to find a way to reach out to those that are hurting the most, even if they're not medical professionals themselves. And I think it's part of the reason, just to go back to politics for a second, it's part of the reason you saw Democrats in that room too. You know, Joe Manchin from West Virginia was sitting right there. There were Democrats I was following on Twitter who were applauding the president for this move. So I think that he will continue to get high praise.
The president also worked in there his talk of a border wall with Mexico. Geneva, I know that you spent time in Arizona near the Mexico border. And to what extent is that connected here to this overall problem?
So in Arizona, it's where a lot of the traffickers bring their drugs in through Mexico. A lot of it's coming up through Mexico. And DEA tells us that Arizona, in a way, is the canary in the coal mine for the rest of the country. They see thousands of pounds of heroin coming through, doses of fentanyl, and then in the upcoming months, there are overdoses in the Northeast in California. When we were there, we went on one raid that we found pounds of black tar heroin inside someone's home, and that alone, just a few handfuls, but it was pounds, could have provided thousands of individual doses worth millions of dollars on the street.
All right. President Trump says today that we can be the generation that ends opioid addiction. We will see. He has certainly put this on the radar screen, and his administration will be judged on the basis of this major piece of domestic policy that he pushed forward today. I'm David Wright with the ABC Digital team. You can continue to follow the story on World News and on Nightline, and of course on the new ABC News app. Thanks for joining us.